Very warm welcome to all of you. Good afternoon. We welcome you to the first episode of the Facets of Impact Season 3, hosted by Newsocia. I am Manju Menon, co-founder and CEO of Newsocia. So Newsocia, to all of you who are present here, we are a strategic CSR design and impact advisory organization. Founded in 2017, we enable the ecosystem for sustainable impact, and we are incubated at the IIM Bangalore NSRC. We are present in 4 countries. In India, we work in over 21 states, working across 14 SDGs. Today's topic of the discussion is people helping people, understanding disaster response. And I'm happy to introduce the moderator for the session today, Pankaj Pallab. Pankaj has spent over 30 years of his career in CSR, sustainability, specifically on ESG, and rural development. He has worked with both grassroots development organizations and larger corporations, including the European energy majors and one of the largest and highest reputed business houses in India. He played a key role in the COVID-19 response by the Bajaj Group of companies and was a member of Pune Platform for COVID Response. He also serves as an advisor to Newsocia, contributing to his expertise to our growth. Welcome to the webinar, Pankaj. Thank you for leading the session today. I'll also quickly introduce the panelists who will be sharing their insights with us today. Please join me in welcoming Colonel Anuj Bhatnagar. He's the head of health at Tata Steel Foundation, where he leads impactful public health initiative in remote and underserved areas. He's also a professor at the Manipal Academy of Higher Education and secretary at the Tata Relief Committee. He played a key role in Tata Steel's COVID-19 pandemic response. An Armed Forces Medical College alumnus with 24 years of services in the Indian Armed Forces, he has commanded military units and served in combat and peace zones. Nationally recognized medical educator and United Nations peacekeeper in South Sudan. Satnam Singh, General Manager at Smile Foundation. Satnam has been handling portfolios of health and disaster response for over 11 years at Smile Foundation. He has a master's in sociology and has over 19 years of experience in primary healthcare, microfinance, informal education, and vocational training. He has previously worked with the Council of People Advancement and Rural Technology under Ministry of Rural Development, Navjyoti Foundation, Shape in India, and Sukarya. Welcome, Satna. Naga Karthik, Vice President at Blockchain for Impact. Naga Karthik is a Vice President at Blockchain for Impact, a public health fund for India, and also the founder of Sauramandala Foundation, an organization that works to improve the development indicators of remote, vulnerable, and disconnected communities. An engineer by education, he had spent over 10 years working across the Indian Himalayan regions and the northeastern states to design large-scale programs across health, education, climate, and entrepreneurship. A warm welcome to all our panelists today. This session will have 2 parts to it. First, a discussion with the panelist, followed by an audience Q&A session. We request you to use the Q&A box below the screen to put your questions, and we'll be happy to take it up after the first round of discussions are over. Over to you, Pankaj.
Thanks, Manju. A privilege to be moderating a session with 3 such stalwarts. So thank you all 3 for being here today. And disaster, I think, yes, I was just looking at last 3 months. We had in June, we had the train accident in Odisha, around 300 dead and many more injured. In July, we had that landslide in Maharashtra, where around another 100 missing, 50 odd dead. August in HP, again, multiple incidents, 300 plus fatalities there as well. We have had this lingering kind of incident happening in Joshimath. So I think last week itself, we had floods in Bharuch and Ankleshwar. So I think this period has been a period of repeated disasters. And I think there needs to be a greater understanding of how we respond. And I thank Newsocia for actually kind of setting this up. I think more of us need to get involved. And I would like to start with you, Anuj, given the variety of geographies, terrains you and your team have worked in, the challenges they have. And it kind of appears to me that the next disaster is on us before we have even finished kind of properly addressing the first one. So, and in this kind of a situation, and they're happening all across the geography, how do you and your team plan your response? How do you, what kind of information you look for? How do you monitor? Are the resources adequate? Because to me, that would be the starting point for the response, right? Anuj, you're on mute.
Yeah, thanks. My bad. So, thanks, Pankaj. Very rightly said. The disaster response actually starts much before the disaster actually strikes, because it's an old adage which goes that should disaster strike, be prepared. So, having said that, the disaster cycle would start much earlier than the time the disaster would actually strike. So, given our the group's varied experiences and learnings that we've had, one thing that we realized is that it becomes absolutely important and imperative that whenever we are looking at a geography, we should be able to map the disasters. And this definitely, a lot of historical perspective has to be taken into view. Of course, there are always going to be certain disasters which cannot be foreseen, like the train disaster at Balasore, uh, that the Tata Group responded to. Uh, these are always going to be there. Earthquakes, uh, definitely, I mean, are going to be there. But if you look at most of the disasters, most of the disasters will give you an advance warning, a fair, lead time. If you're looking at floods, you would get a lead time. If you're looking at landslides, we responded to the recent landslide at Raigad. And when we go into the detail, we realize that there have been repeated landslides in these areas because of the deforestation. The soil has become loose. There is heavy rainfall accompanied by steep slopes, and you have hamlets and villages located at these steep slopes. So
And
we are
human
we are looking
interference in
at
the
a
slopes as well. So,
yeah. So we are actually looking at a disaster which is actually in the making. So it becomes very, very important. So that becomes the starting point for any kind of decision making or any kind of preparation. That what is that geography prone to? It's very important for any civil society organization which goes in or is working in such an area to be aware of that. The second, I feel something that is again very, very important is the preparedness at the community level, the sensitization of the communities, the working closely with the communities. And when I say communities, I also include the government and the quasi government organizations which are working in these areas. So it becomes essentially very, very important for any civil society organization, I think, today. Gone are the days when we can think of ourselves as working in an isolated box and not talking to the government or not talking to the communities. So gone are those days. So we, for example, we have the SDRF, we have the NDRF, we have experts on ground. So it becomes very, very important that we have a ongoing dialogue. Even in the case of Balasore train tragedy that we saw, that we responded to, our teams were constantly in touch with the district administration. We'd set up numerous help desks at the hospitals in the district headquarters. We took an active part with the government. So that kind of hand in glove has to now come in whenever we are looking at any kind of preparedness. And the last point on this that I feel is very, very important is what kind of capabilities we have as an organization. It's very, very important to know where to respond, where not to respond, what are your own capabilities, and above all, what are your limitations. It becomes very, very important not to go into an area where you have certain limitations and let that be taken on by the experts. So that I feel has to be done at the very beginning when we are planning for any kind of disaster response. Yeah,
yes.
over to you.
Thanks, Anuj. I think two remarkable points. I think the last one I will take first. I think the responder should not become a liability on the actual responders and to the communities who are already in distress. I think quite often it is forgotten, but I think it's a very, very important thing to be remembering and keeping track of. And you'd also raised the point about the involvement of civil society, both in advanced preparation and planning. And Satnam, I would like you to kind of give your views on that, because as Anuj is saying, many of our areas, many of our times are prone for disasters. We know monsoons are a period where we'll get people in distress. We know summers, especially in certain parts of India, would be distress at certain times. So what have been your experience in working with civil society, both as Anuj saying in the prior preparation as well as actual response to and in the face disaster?
Right, Pankaj. And so we as an organization, Smile Foundation is working in disaster response since 2002. And taking it from the point which Dr. Bhatnagar made, that, we should know that what are our expertise and accordingly we should respond. So we as an organization is more into relief and rehabilitation. We are not into rescue. So when we talk about relief, we focus on health and nutrition, that is food and health and hygiene. These are the two things which we during the disaster, and then after definitely the rehabilitation part. Coming to the question which you asked, when we talk about preparations, the pre-disaster, and we are now as a country are very much prone. Like, for example, what we talked about Himachal, we talked about the hilly terrains, but what has recently happened in Punjab? I mean, after around 20-25 years, this has been repeated. So taking that into consideration, I think first thing that we all, and as a civil society organization, we promote is the understanding the capacity building and the preparedness. Not only the capacity building inside the organization, but also of the communities, and especially for the frontline workers who are working on the ground. Now, this preparedness is not only just focused and centric on how to respond, but also on various topics like first aid, what are the do's and don'ts, that is during disaster and before disaster. Point number two, we as an organization sensitize on a lot of awareness activities which are directly linked to health awareness, because when such thing happens, there is a possibility of pandemic in the entire area. So need to focus on that. Also, third thing, as an organization, we work very closely in convergence with the government, because ultimately they are the people who is taking it to the logical end. We are there just as a catalyst or a bridge to bridge the gap over there in the community. So we work with them very closely, and it is also important that we need to understand what is the need of that particular area. Secondly, with government, that how we can avoid being duplicacy on the ground, because when such thing happens, many organizations, many individuals come to those areas, the disaster for the response, and it is important that we channelize those resources which are coming, so that it should not be concentrated at one state. So being a facilitator, being working with the government over there, right? And also, if we talk about COVID, like we faced COVID in last 2 years, starting from 19, 20, and 21. So over there also, how much we are adaptable to that particular situation in terms of, like, nobody has worked on COVID before, but how we responded is to run our COVID-19 MMUs to support the government for increasing the number of tests in the community, which was a huge challenge at that point of time. We were on the ground immediately after 1.5 months, 2 months of the nationwide lockdown, after the permissions from the state governments to work on health. So we were started our OPDs in the communities over there. Responses to the introduction of the vaccination. So what I'm trying to do, Pankaj, is I'm trying to build that scenario where there is, on one hand, there is the natural disasters, and on the other hand, there is man-created or, the medical disaster which we have faced. So we as an organization is responded at two levels. One is definitely with the community, but in hand with the government, so that we can, adopt to the requirements of that particular community and the area. Because sitting over here in Delhi, creating strategy will be a difficult task unless and until we go there on the ground and start working with the government. And as a mandate that we have to be there on the ground within 48 to 72 hours of any disaster response as an organization. Yeah, so that is how we are trying to work between the community and government, and how we are preparing and creating awareness in the communities.
Well, I think completely resonate with what you are saying, because the Pune example in COVID, where we created this platform for COVID response, we had all government departments, we had all the hospitals, public and private, we had the entire civil society network and the industry, and a lot of sourcing of the material for making masks. There was somebody in Singapore who was able to procure it, get it pushed into the airlines, ensure it was kind of cleared by customs, delivered here, manufactured, given to the hospitals ASAP. So I think there's a lot of value in people working together. And I think the fact that many of these platforms and collaborations die out after disaster, to me, is a disaster itself. I mean, we know something else is going to happen and these networks need to remain alive. But yeah, so that's, I think, but Naga, coming to you, I think one of the, and COVID, I think, was a good example where a lot of responders got locked down and were unable to perform their jobs because of the nature of the incident. And what I understand is that, and financial resources were a huge requirement. Even when we knew where to procure material from, we were unable to make payments, we were unable to kind of ensure that we had the right to pick it up. So it will be really worthwhile for all of us if you could share how you went about creating this. I mean, I was amazed when I heard about it, this new alternative mechanism for securing funds, and what value it has as we move forward, because that's not the end of it, right? I mean, as you also saying in your organization, we are moving forward with this. So what exactly did you do, and how can we all learn from it?
Thank you so much, Pankaj. So we started off as a relief initiative for crypto relief during the second wave of the pandemic, and very funnily, we actually started with a tweet. So Sandeep, who's the co-founder of Polygon, which is one of the largest blockchain projects in the world, as like you mentioned, I think everybody was the pandemic sort of was something that affected everybody, and everybody was trying to problem solve and see what they could do in whatever positions they were in. And then I think for the first time, a lot of the things like lack of beds, lack of medicines, which is usually reserved to say the rural poor or certain pockets of society, became a problem for everybody. Didn't matter how big, small, important, non-important you were. And I think this was a time where Sandeep's family had also come down with COVID, and then he put out a tweet saying that he was reaching out to his community that he works with, saying, that that he couldn't watch this happening, and he wanted to create some sort of a response to this and basically do his bit. The idea at that point was not to turn this into a fund, but to do relief. But I think as somebody who is aware of the power that the blockchain technology has, and basically he put out a couple of public wallets where everything was transparent. People could donate to the cause. People could actually respond quickly, and versus a traditional mechanism where if you were to set up a new process and an entity, it would take a couple of weeks, if not months. But no, the fund was able to do this in a matter of 2 to 3 days, rally around a bunch of volunteers, and actually start off, I think, relief work by the fourth or fifth day after the tweet was made. It's another story that we ended up raising close to $400 million during the course of that. But I think the first contribution we started making was to people who were closer to the ground, because the general belief was, I think, which both Dr. Anuj and Satnam have covered, is I think the people closest to the problem have the best understanding of what is needed. Sitting far away from it, I think we believe that a lot of the things will work, but actual ground reality trumps everything else. So we decided to take a trust-based approach, saying, we know that these people on the ground are doing whatever is needed. It is a humanitarian crisis. And sort of let's build the rapport with them and do whatever it needs to actually get the money across. So I think in a matter of less than a week, we figured out uh, the FCRA pieces to convert cryptocurrency into fiat, bring it into the country as US dollars, uh, KYC processes. So all of this were literally an organization was set up, a team was built, and processes were built to actually make this happen. And I think that was sort of like a crash course for us in terms of learning how to design and build things at a very very rapid pace. And it ended up becoming an example, I think, of how the blockchain technology itself could help create vehicles of this sort. So I think none of us knew what we were getting into, but I think it's been it's been a huge learning so far on as to how we could use technologies to actually respond to incidents as and when they happen.
And the organization and the framework still exists and is there, or?
Yes, so we've rebranded to Blockchain for Impact since then. So at a point, we were about 45 plus volunteers who were running the initiative. Now the idea is to really look at resilience building. The idea of rebranding to Blockchain for Impact was to move towards a more strategic approach uh, that the fund could have during peacetime, but to actually use it to build resilience in the healthcare system that is there. So that is to look at research and innovation. That is to look at building capacities of grassroots uh, health systems at the district levels, so that if something like this were to happen again, and which it will, we are better prepared. But definitely, I think it carries on. The entity exists. A lot of the volunteers are now sort of like myself. So before this, I'm also founder of another NGO. I used to like we still work out of the Northeast, but now this has become a large part of what we're doing, and we see this as an opportunity as custodians of this fund to actually help build this resilience going forward.
Thanks. So I think, and you have given me a lead to the second question, which I wanted to kind of start asking. Anu, that you mentioned about the disasters give us a long warning, and I think we have no excuse to not being prepared in many cases, apart from things like say earthquake. But even then, the zones are kind of fairly well known. We know zone 5s are likely recipients of gift of God in that case. But they also have a long tail as well. That once a disaster strikes, I mean, it disrupts the livelihood, disrupts families. So, what has been your group's kind of position on managing the tail of the disaster and like some experiences and some learnings from management of the tail?
Yeah, thanks, Pankaj. It's a very interesting. It's been a very very interesting experience and learning process for the team. The tail is really long, as you rightly said, and we are also into the rebuilding process. Rebuilding the communities and the community institutions. So, as a group, we've been working. We are just winding up our rebuilding interventions that took place for Hudhud. We are now winding up our, this thing from Tata Relief Committee. We are now in the process of winding up our activities, which we started as rebuilding activities in the J&K flash floods. So it's a really a long and a sustained kind of effort that you have to do. So one thing that I have personally, the team has learned is that there cannot be a quick in and out. If we are looking at a disaster rebuilding, uh, everybody and all of us should understand that it needs that kind of organizational resilience. It needs that kind of organizational commitment. Just going in and doing something and getting out within 15 days possibly won't work for the communities. Like, for example, in J&K, we are building schools. We are furnishing the schools now. The entire schools had been wiped out. Similarly, in Hudhud, we are setting up, as an aftermath of Hudhud, we are now setting up the community health centers, which had actually got wiped out. And Odisha is our, what we like to think of Odisha is our Karm Bhumi, so to speak. And, Odisha is also the state which faces the maximum disasters as far as, cyclones and other things are concerned. So this is again a kind of a rebuilding process. But the one lesson that the team has carried is that there has to be a long-term commitment. There has to be a preparedness and that commitment for a long-term engagement with the communities. So that is something that we've learned as far as the tail end is concerned. Again, when we are looking at the rebuilding, uh, what we also saw in Bhuj and other areas, it's no use rebuilding, schools or houses, which are going to be again falling down when the next earthquake strikes. So that kind of, engineering designs and that kind of, it should be the buildings that we are looking at while rebuilding should be able to withstand, because obviously today has to be better than yesterday. So that's what we look at. But yes, the long-term resilience, long-term commitment, and it's definitely we are looking at anywhere between 5 to 10 years of engagement, depending on the damage.
It makes sense. So, I mean, I'm always surprised by why, like the entire East Coast, which gets between 9 to 15 cyclones annually, guaranteed hai wo to, why are public buildings not designed to be storm shelters in the first place itself? Why are we having these asbestos tin roof schools and PHCs when the community is going to live in like waterland daub and kind of structures which they can afford to build? The public infrastructure should be able to be a lifesaver in those cases. So as you're saying, what we rebuild has to be rebuilt with multiple purposes in mind. It should be survive the incident definitely, but should also provide shelter to the next inevitable kind of disaster that comes around. So definitely. So Satnam, to me, the other thing, Anu said the tail is like 5 to 10 years long. Like I was in CSR, right? So there is a lot of frenzy when the disaster happens, right? Everybody wants to put their money on the table. But then it goes away and the next kind of flavor of the month takes over. So what has been your experience with your donors? Have they remained consistent with rebuilding and kind of re-energizing community or strengthening community to prevent disasters from kind of having the similar impact? So how has been your appraisal of the donors and of the civil society institution that you work with?
So, Pankaj, before that, I will make a comment before coming to your question, that how Smile Foundation is placed at national level, and I will then connect it directly to your question. See, we are working with around 400 grassroots level organizations at Pan India level, and we are having a team of around 700 people, which includes medical, paramedical, teachers, all those kind of set of people working on the ground. Now, why I'm making this statement? Because, see, it creates a lot of hopes in the community because you have a presence. And definitely in such circumstances, people expect that you respond and you respond for a longer period of time. So the stakes get high because you are there in the community with that much of bandwidth over there. Now, when disaster happens, and as I mentioned that we work only in relief and rehabilitation, focused on health, focused on food and water and health and hygiene during the disaster period. So we get a lot of supports from the corporate, and this corporate support is not only just to for the immediate basis what we are going to do, but from the long-term basis also. And there is no set formula for a rehabilitation phase, because in Odisha maybe something will work which will not work in Kerala, because the livelihood opportunities for these people are very, very different. Yeah, so that combination and tweaks we have to do on the ground. We'll give you a few examples, like when we responded to Uttarakhand floods in 2013, and we were very closely working with the government of Uttarakhand and United Nations disaster response team. So we have been assigned with a task to run the medical facilities in Ukhimat. So we were covering the PHC of Ukhimat along with having a static clinic in Sohanprayag. So Sohanprayag and the villages of Ukhimat that we were working in. When we came to Chennai floods, the need was very different. It was Chennai and Kanchipuram district. So we again, along with the relief, when we started the rehabilitation process, as Dr. Bhatnagar mentioned, we started with building up the infrastructure for the governments. We are not into the civil work, but more in the refurbishment of the schools and health and hygiene facilities, and also providing the facilities to the PHCs or any health system to upgrade them. If we respond to the Kerala floods, we have provided them boats and nets to the fishermen community. So these are few examples. Now, coming over here, when we talk about responses and appraisals from the corporate, one more thing I'd like to add is the compliances part. Because it is not just the investment of the money and routing to the money to the ground, but also how we are compliances to all the rules and regulations of the government indirectly and directly to the corporates. That we need to look into, and it becomes more important because disaster response involves a lot of procurements and supply chain management. Yeah, so we are working on that part also. Also, from the corporate point of view, one culture which is coming up is to respond based on the national, state, or district level disaster. That also plays a role. So again, coming back to your question, yeah, this is how we are working on the ground in terms of providing the facilities in convergence with the community and the corporate, keeping in mind the need what the government is aligning to.
If the donors that you are working with are interested in being with you for the long haul, I think that's a very remarkable event, because a lot of places we have seen switches in focus happening. I mean, while in COVID, everybody was putting all their resources into health response, but it very rapidly has now moved into skilling and education. I mean, last 2 years, very little money has gone into health. I mean, almost like compensating for health expenditure in 20 and 21. So Naga, I think Satnam used a couple of interesting words, which in my head at least, were linked to blockchain, the avoidance of duplication and tracking and tracing and transparency. So do you see it becoming more kind of universal as we start kind of becoming more kind of focused on trying to avoid these, given a lot of resources do tend to flow without coordination into these kind of activities? And has there been any interest by any local civil society network or by government into adopting blockchain and its kind of the rest of the technology kind of ecosystem to deliver efficiency on the ground?
The honest answer I would say is that yes, it is possible, but I would still say that the technology is still nascent. So maybe it's not ready for say a mass scale pilot or a tool that civil society could sort of use and actually benefit at the level at which the technology itself is right now.
Right.
But that being said, I think even during the relief work that we were doing, what ended up happening was there was a lot of conversation on exactly this point with the other donors to because there after a while there was an understanding that all of us were being approached by multiple organizations, multiple governments, and so on. And we needed to actually have this sort of a platform where the donors or the people who are sort of helping mobilize financial resources at that point could actually do the best that is possible, and which is to equitably distribute your resources. So I would say that I think going forward, the technology inherently, because of how it is built, will definitely play a large role in it. But I would still say that we are a good couple of years away from that. But I think this was one of the points where a lot of our resources, in terms of time, the amount of time that we spent in figuring out who all were working in which region, building the trapo, speaking to them before actually making some of our investments and into the fundings of the release efforts, was quite considerable. So and I definitely feel that disasters being recurring and the kind of scenarios in which they play out, which is very unpredictable, there will eventually be tools like this which will be required. Maybe the ones that already exist now don't run on the blockchain technology, but for sure.
Right. Right. Good to know. I mean, we need to be ready for it, then we need to be ready for it first. So, Satnam, I'll come to you after one last question to Anuj, and I would be asking you the question that is there in the chat box, if you can kind of mentally prepare yourself. But the question I wanted to ask to Anuj was that I was a part of health and safety teams in my oil and gas companies, and I had the misfortune of seeing two fatalities, right? And I found that traumatic, right? And we were given training and everything, but I still found it extremely traumatic. And a lot of responders in disaster are not prepared professionally as a first responder, right? And many of them are volunteers, many of them do for the first time. So, so how does it impact them? What kind of long-term repercussions do they have? Is this something we need to be concerned about as we get more and more volunteers engaged with the disaster relief activities?
Yeah, so thanks, Pankaj. You've actually touched a very, very relevant point and touched actually a very, very raw nerve. I'd like to share the recent experience of the team when we responded to the Balasore train tragedy, and the message that started trickling in at about maybe 6:37ish in the evening, and we have a team of people over there, and they were mobilized to respond because there was a general requirement of a immediate response in terms of the rescue also. And so the team members rushed to the spot. They some of them took charge of various issues. There were bodies being extricated from the bogies. There were body parts being assembled. So it was a very, very traumatic kind of an experience. Even to some extent, even for trained doctors, I would say. And these were the people who are volunteers. We have a large project which is running in Odisha, and they were mobilized. And then they took charge of the dead bodies because there was nobody to really look after that. Along with the district administration and the district officials, a school was requisitioned, was taken over where the dead bodies and the body parts were initially taken. Then subsequently, a decision was taken by the government to move the dead bodies to Bhubaneswar for for storage and DNA analysis, etc. And so the team worked at that part also. They set up the help desks at various places, including at Bhubaneswar, dealing with the relatives who had started pouring in, the queries which had started pouring in. So then subsequently, the leadership at Tata Steel Foundation, we decided to reach out to the team and have an interaction with them. And it was actually an eye opener because a lot of the youngsters, and they were all very young people, boys and girls who had responded and who had actually risen to the occasion beautifully. But what we realized after that was they almost all of them had some issues which pointed at a very, very severe PTSD syndrome for them, the post traumatic stress disorder. Because people said nightmare होते हैं, रात में नींद नहीं आती है, they get up in the night screaming, visualizing the dead bodies and the dead part. So that's a very, very real issue, especially when we are looking at immediate response. It's very important to, number one, have people prepared, mentally prepared, emotionally strengthened uh, during the peacetime. During the peacetime. So that's very, very important because when the lesson we took from Balasore train tragedy was that once we are responding to a disaster, the time will not be adequate to prepare them emotionally. We'll have to just mobilize the people. So it's that the peacetime is the time when we need to have conversations with them. We need to, tell them how to handle the emotional stress that they will naturally be going through. And it's actually now a time when we even looked at, some kind of a professional psychological counseling or maybe some psychiatric counseling for people who've been closely involved, because ultimately it kind of reflects on their personal life and it does affect a personality. So that's some of these people, some of the youngsters did reach out to us, although they were very happy, they were very proud that they rose to the occasion. But I being a doctor, I realized that there was definitely an element of PTSD, which we need to take care of when we are pushing our people into such kind of responses immediately. Yeah, thanks.
We have seen, I think, even volunteers who man like self-harm helplines, and we see similar kind of stresses emerging in those volunteers as well. I think volunteer in extreme distress, wherever that combination happens, we do need to be alert to that. I think that's something that is not baked into a disaster response, but definitely should be. I think that needs to be an important part of.
Yeah, and I would just quickly like to add also that we were talking about the COVID-19 pandemic. That was the time when I was heading the emergency medical services at Tata Main Hospital, and I had quite a tough time, in the sense that the doctors and the paramedics, the kind of patients who were coming in, and the numbers, the quantum, the sheer quantum of the patients who were coming in, it is actually very stressful because even as a doctor, even as a trained doctor, I mean, I would like to think that as doctors we are trained to deal with death, but I feel the pandemic, gave a new meaning to that, and we did went go through some tough times emotionally and mentally, because there's nothing much that you're helpless, and that kind of frustration sets in even in the wards, the kind of ICUs, the CCUs, the people working there, the paramedics, the nurses. I mean, so there is a need to look into the kind of issue of mental health for the responders at all levels. Thanks.
I think yes, very important issue. I think we don't consider the responders' health enough. I think in many situations. Right, Satnam. So I think now we are in the last 15 minutes. We can take a look. We have only one question so far. So we have answered, I think, bits and pieces of it as we have kind of gone through the session. Given the current climate change scenario, that drought-prone, flood-prone, and these kind of are annual occurrences now. And are there any experiences where we are leveraging our past experiences to create processes and SOPs to roll out the appropriate activities? I think from the very beginning, from Anuj's first response, I think we have been around this space, but if you can give a specific response, Satnam, that would be very nice.
Yeah. So, Pankaj, we have 2 questions in the Q&A also. So total, I think 3 questions that that are there. Yeah. So coming to this particular question, considering the climate scenario and all. So I think one change that we can do about is, and again, as Dr. Bhatnagar mentioned about the psychological effect of all those post-disaster effects. So before that, when we talk about our entire system, we don't have any such provisions in place where we train our frontline workers who are very much present, very much in the community. And when I'm talking about frontline workers, I'm also referring to the teachers and Anganwadi workers and ANMs and ASHA workers who are working actually on the ground about any kind of disaster response. So they have their trainings in their respective, thematic areas, but not been trained about handling any disaster or any first aid in their respective villages or urban slums. That may create that dent. If any such unfortunate things happens in the community, there will be the people who will be actually responding. Because we are talking about volunteers who will reach there within 24 hours, 16 hours, 48 hours, but those people can actually start responding immediately on that basis. Second thing, I think also some kind of preparational at the national level, right? Where some kind of maybe a joint forum or something can be there at a national level, where as per the expertise from where we actually started, that we should respond as per our expertise. Those expertise and organizations can be enlisted and immediately can be guided to get the work. Taking the work on the ground where any such thing happens. Now, flood, we talk about drought, we talk about earthquakes. They are very, very different kind of disasters, and also the magnitude is very different. And if we talk about medical, that is an entirely different thing. So that is the second thing. Talking about SOPs, I think, of course, all organizations will definitely have SOPs in place, but consolidation of that. and one paper which will be the Bible kind of thing for everyone to respond to the ground as a policy from the government side, which can be equally applicable for everyone. I think that can change some kind of scenario, which is because it is not only just from the corporate sector or from the civil society sector or from the eminent individuals like Naga who are, get aligned to the situation and responded, but also from the grassroots level can be aligned to this entire thought process.
Completely agree. I mean, the fact that in India we are still fighting on LinkedIn. I'm having a dispute happening. The 3 million NGOs is a complete nonsensical number, because the number of entities that currently have an 80G tax exemption is something like 3.5 lakhs or 4 lakhs. So there's a couple of zeros missing somewhere. So unless we get a clarity on how big the sector is, who is where, then map expertise, is difficult to do coordination in absence of these basics. And I think the sorry, Anushka, share it. Yeah.
Please continue. Then I'd just like to add a point.
No, I was just looking at the next two questions that I don't want to make it very kind of that because tech likha hai, so I'll ask Naga to respond. I was thinking, can we just switch those two and we ask Naga about innovation, and Anuj, if you can talk about how it has evolved. I mean, as we have moved along, especially technical tools and disaster relief. Yeah.
Thanks. So I'll just come in for a moment in continuation to what Satnam had said earlier, and I'd like to share an experience, and maybe maybe somebody may like to take it forward from here. This is my experience with the armed forces, because wherever disaster strikes, armed forces have been traditionally being the first one to be called out and respond. So I've been part of such a response. So we used to have a concept known as a disaster brick, and it works in terms of engineering, it works in terms of medicals, it works in terms of your sustainability, food, whatever. I mean, you can tailor make it. So this is something that I did carry from the armed forces into my days with the Tata Steel Medical Services, and it worked beautifully for us, because you have a concept of a disaster brick, and that is your premium, or that is the kind of आपकी insurance है वो. That's the insurance against the day when the disaster will strike. Because we've realized it, and very painfully at times, that if at that point in time, if you start collecting your resources, it'll take you at least maybe 4 days or 5 days to just gather your material. So it's very important to respond within hours, because we have a system where a full-fledged hospital, including the operation theater, can be rolled out in 6 hours in the armed forces. So that is the kind of response if we are looking at every district level, I think it will be worthwhile for every district administration to have a disaster brick in their it could be storage of drinking water, it could be storage of dry food, the works. I mean, it could be storage of your kind of equipment, could be storage of your engineering equipment. I mean, so that is something that
nothing else, even diesel for generators in the hospitals. I mean, it should not be in a position where every 6 hours somebody needs to go and fill a jerry can. So oil and gas, when Gulf of Mexico happened, in aftermath of that, now I think across the globe a full-fledged disaster, like the thing, a disaster response kit has been prepared, is available to everybody. It is palleted to the size to fit into any commercial aircraft's freight bay, and it can be moved wherever in the globe. And every disaster team in any oil and gas company is trained on how to use that particular kit only. So you don't have to train any individual. It is there. It can be dropped via parachutes if required. But it's such a good advice for at least the disaster prone districts and states of India. If not for every single this thing, definitely it should happen there. So sorry, my screen has switched off.
Yeah.
So Naga, would you like to talk about the technical?
So I think
sorry.
There was also this question about, I think, balancing between I think rapid response and long term. So I think maybe I could add something there, because I think that's kind of the direction in which our thought process is also changing. So I can actually give two examples of projects where we're doing something. So I think one is we funded this large scale project with Selco Foundation, where we essentially funded the solar powering of about 1,400 plus health centers. So even though this happened during the COVID pandemic, the idea was, can we actually build long-term resilience into these health centers so that they are functioning regardless of what else is happening? So you have your basic light, fan, mobile charging, plus a basic set of equipment, depending on whether it's a sub-center, PHC, CHC, and or even a district hospital. So I think that was one example. The other one is a project that we're doing that we're funding in Dhubri. Dhubri is Lower Assam, is a annual flood-prone region. There is one of the, I think, lowest numbers for one of the highest numbers for maternal deaths. And this is largely because also that the health system becomes inaccessible during the peak of the floods.
Right.
So we're working with an organization there to actually help them set up a hospital ship, which is supported by a couple of boat clinics. And the idea is that you design the health system. Let's design a health system that will work at the peak of the floods the best. So if we are able to ensure that, then at the peak of the floods, you are able to ensure, for example, that there's primary, secondary, tertiary care that's available. The boats are able to go inland. They're able to actually reach the people who need any sort of medical help. On the ship, we envision that there'll be cold storages, so you can store your vaccines and medicines and so on. And along with that, what we are now trying to sort of co-design with them is to actually start a medical fellowship on this ecosystem, where if we could start off by funding the costs of having a gynecologist, a pediatrician, and an anesthetist on this ecosystem that is there, that actually, one, it becomes a very unique experience for somebody to participate. So that should draw people who are dedicated, who actually want to come in and participate in something like this. Two, it plugs the human capital gap that is needed to run an ecosystem. And three, if we were to do this fund this as a philanthropic effort, but pitch it back to the government to be run as, I don't know, either an Assam specific or a chief minister's fellowship of a kind, you have then brought in the political narrative into it as well. So it is then desirable for the community to have it. It is desirable for the political system to have it, and we are able to give them something after trying, testing, fail. So I think that's sort of the thought process for us when we say balance. Of course, rapid response will be needed at the time of floods, but could we then, in the other time, actually fund and build ecosystems like this, which overall helps, I think, build the resilience of that region on the whole, and then we're able to even respond better.
I think, and what you're saying, Naga, is actually addressing both two issues. I mean, there is an immediate local resilience being created. You're also creating a proof of concept that has much wider applicability. I mean, the boat can become a truck in some instance, but the idea being that at the time of stress, you need to be able to take healthcare to the people, whether it floats or whether it swims or whether it flies, it doesn't matter. I mean, that the concept is movable around. So I think, yeah, you're addressing two. So I think part of what trends and innovation you see, I think it's kind of answers that query as well. Yeah. So Manju, if you are there, I'm not sure how do you want to give us to give literal answers to each, which technical tools I use for disaster alert. I mean, all of us have faced our mobiles kind of going ballistic suddenly in the middle of the day when the government's that early warning testing has been happening. So I think there's some movements by the government as well to at least be in a position to communicate to us about an impending disaster. But
I think we have touched upon most of these questions also as we were discussing, and a very good discussion. I must say that we've touched upon many important aspects of responding to a disaster. and we have also looked at the importance of preparedness as well as rehabilitation or post disaster event measures that needs to be taken care. So I think it's a big responsibility to kind of sum it up, and I don't know how to do justice to this, but I'll still kind of look at the major points that we kind of spoke today. So right from the focus on the preparedness, that's where we started, where we mentioned that there are historical data regarding disasters, and that needs to be really understood. There's a scientific approach that needs to be taken when we look at some of these events, and how do, as people who are involved in it or as organizations that are involved in it, how do we really look at those data and start creating resilience at the ground level. And we also looked at the role played and the interrelationships of various organizations, including the government as well as civil society organizations, in the event of a disaster, and why is it important to have that collaborative effort happening on the ground, so that there is no resource duplication, there is quick response, and and what is needed is happening on the ground. And I think one of the speakers also touched upon the importance of why we should ensure that the responders should not become liabilities during a disaster response. And we also touched upon the importance of the mental health and psychological health of responders, which are two different things, but still needs to be taken into consideration when we are speaking about. So often these conversations are on the community, but there is a significant stakeholder which is sitting there who is responding, and that responder also need to be understood, and their needs need to be understood as well. And also a related point is, how do we build ground level volunteers and their capacities? Because end of the day, for anyone external to reach to the venue and respond takes some hours. And how do we build community volunteers and other resources in the community who could be trained on basic skills, including their psychological support to respond? And we also spoke at an organizational level, how do we have strategies which are not just limited to response, but cutting across preparedness, response, as well as rehabilitation, and how some of the organizations are looking at rehabilitation. It's a long-term process, and it really takes, some of these locations really takes a long time to rebuild from where they have gone down during a disaster. And we also looked at why is it important to have that supply chain? When a disaster strikes, there are multiple things that need to operate together. So it's like a system coming into coming together. And why is it important to have those mappings happening across which are the people who are need to be brought in together, and have a kind of a a SOP around it, in terms of having a listing, an SOP around it, in terms of, and available to everyone and across the country, that this is how one, or at least a guideline as to how we can respond to some of these events. And so some of these with the major points that we were looking at, and I think a brilliant discussion. I think we can keep on discussing. I think we probably need a full day to look at this topic in depth that it really deserves. But having said that, this particular webinar series, we kind of focused on 3 topics, and we kind of broken it down into 3 parts, because the preparedness itself is a big part which needs to be really understood much deeper, and as well as rehabilitation is another part which need to be understood better. So therefore, we'll be having 2 more episodes of this particular webinars, where we'll be specifically focusing on preparedness element, and on another one which will be focusing on the rehabilitation element. So a big thanks to all of you, the panelists, as well as the moderator, for having a beautiful discussion, touching upon the crucial aspects of. And since all of you have been part of this individually as well as an organization, I think the responses were really coming from your own lived experience of some of these things, and both as individuals as well as an organization. And I believe that people who are listening to us today would have got a lot of insights if they are playing any role in the whole process of responding to a disaster. So as to the audiences here, as I said, we'll be coming back to you next Thursday with our next episode, which is on rehabilitation, and we'll have a separate panel who will be who'll be deep diving into the rehabilitation measures and strategies that they use after a particular event strikes in a location. So thanks once again for joining us, taking out the time, especially during a lunch hour, to be here. And I hope it was a very informative session for our audiences as well. So good day to all of you, and
Thanks,
thanks very much.
Thank you.
Thank you all. Thanks.
Thank
Bye-bye.
you.
Thank you.
Thank you. Bye.
Thank you so much.